how often should I see the chiropractor? This is going to be highly dependent on the type of condition we're dealing with, but I'll answer this as two common scenarios. So first one being somebody comes in with acute low back pain, right? How often are we going to see you? For how long are we going to see you? Typically, if somebody's in really bad acute pain, we'll probably want to see you 2 or 3 times for a few weeks. Make sure we get that pain under control. Start identifying some of these functional indicators that may have led to that pain, or you developing that condition. But usually in that acute phase, we like to be fairly aggressive, see you quite often for a couple weeks, 2 or 3 weeks usually. Once you're out of that initial pain phase, we'll start to see you less often, maybe once or twice a week for a few weeks, as we really dig into those functional indicators, how you're moving, things that you need to be doing outside of here. We identify, hey, are you lacking the basic fundamental movement skills to be able to do that in a confident, pain-free way that doesn't lead to potential future injury. If we identify any weaknesses, we address those. And then once we get you out of that kind of functional rehab phase, where we're more in the maintenance kind of, we're more in that maintenance realm, once a month, some people like to come in. I would say for regular care, once every 2 to 3 months, probably at most. That allows us to be able to basically identify are you losing joint range of motion that you don't normally notice throughout your day-to-day life? Are there the functional exercises going well? Do we need to change anything about the way that you're exercising, the way that you're moving, so that we can keep you out of that acute phase where we're having to see you quite as often?